Hello everyone. Diabetes is a global health challenge affecting millions. It's a condition where your body struggles to manage blood sugar levels effectively. But did you know there are different types, each with unique causes and treatments? Understanding these differences is crucial for patients, families, and the general public. Today, we'll demystify type 1 and type 2 diabetes. We'll explore what sets them apart, from their origins to how they are managed. At its core, diabetes involves problems with insulin, a hormone made by the pancreas. Insulin acts like a key, allowing sugar from food to enter your cells for energy. Without enough insulin, or if your body doesn't use it properly, sugar builds up in your bloodstream. This high blood sugar can lead to serious health complications over time. Type 1 diabetes is an autoimmune condition. This means your body's immune system mistakenly attacks and destroys the insulin-producing cells in your pancreas. It's not caused by diet or lifestyle choices. The exact cause is unknown, but genetic predisposition and environmental factors are thought to play a role. It often develops in childhood or adolescence, but can appear at any age. Symptoms typically appear suddenly and can be severe. These include extreme thirst, frequent urination, unexplained weight loss, increased hunger, and fatigue. Blurred vision and mood changes are also common. Because the body produces little to no insulin, treatment for type 1 diabetes is lifelong insulin therapy. This involves daily insulin injections or an insulin pump. Careful monitoring of blood sugar levels, carbohydrate counting, and regular exercise are also essential. Type 2 diabetes is far more common, accounting for about 90 to 95% of all diagnosed cases. It usually develops gradually, often in adulthood, but is increasingly seen in younger individuals. With type 2 diabetes, your body either doesn't produce enough insulin or, more commonly, doesn't use insulin effectively. This is known as insulin resistance. Over time, the pancreas may become exhausted and produce less insulin. Risk factors include genetics, obesity, physical inactivity, and certain ethnic backgrounds. Lifestyle choices play a significant role in its development. Symptoms often develop slowly and can be subtle, sometimes going unnoticed for years. They can include increased thirst, frequent urination, increased hunger, fatigue, and blurred vision. Slow healing sores and frequent infections are also common. Treatment for type 2 diabetes often begins with lifestyle modifications. This includes dietary changes, regular physical activity, and weight management. If these aren't enough, oral medications or injectable drugs may be prescribed. In some cases, insulin therapy becomes necessary. The fundamental difference lies in the cause and how insulin is affected. Type 1 is an autoimmune attack leading to no insulin production. Type 2 involves insulin resistance and often insufficient insulin production. Type 1 typically has a rapid onset, often in younger individuals. Type 2 usually develops slowly, often in adults, and is strongly linked to lifestyle. Understanding these distinctions is vital for proper diagnosis and effective management. For type 1, insulin is always required from diagnosis. For type 2, treatment often starts with lifestyle changes and oral medications, with insulin potentially introduced later. Both types require careful management to prevent complications. Despite their differences, both type 1 and type 2 diabetes share several common symptoms. These are often the body's way of signaling high blood sugar. Increased thirst and frequent urination are classic signs. The body tries to flush out excess sugar through urine, leading to dehydration. Persistent fatigue is another common complaint, as cells aren't getting the energy they need. Unexplained weight loss can occur, especially in type 1, as the body breaks down muscle and fat for energy. Blurred vision, slow healing sores, and frequent infections can also be indicators. Diagnosing diabetes typically involves blood tests, such as a fasting plasma glucose test, an oral glucose tolerance test, or an A1C test. These tests measure blood sugar levels and provide a picture of how well your body is managing glucose. Regardless of the type, managing diabetes is a lifelong commitment. It involves regular monitoring of blood sugar, adherence to medication or insulin regimens, and a healthy lifestyle. Education is key to empowering individuals to take control of their health. Working closely with a healthcare team, including doctors, dietitians, and educators, is crucial. They can help create a personalized management plan. Regular checkups are essential to monitor for complications and adjust treatment as needed. Living with diabetes requires continuous effort, but it doesn't have to define your life. With proper education and self-management, individuals with both type 1 and type 2 diabetes can lead full and active lives. Understanding your condition, making informed choices, and seeking support are powerful tools. Knowledge empowers you to manage your blood sugar, prevent complications, and maintain your well-being. Remember, diabetes management is a journey, not a destination. Stay informed, stay proactive, and work with your healthcare providers. Your health is your most valuable asset. Thank you for watching. Don't forget to like, comment, share and subscribe the video and press bell icon for more health tips and information. See you in next video.